The state's crisis standards of care framework has raised concerns among some residents. The document was created over a year ago in case the state ever found itself in a grim COVID situation and was made public earlier this week. Some say Hawaii should never get to that point. Nikki Schenfeld explains.
It's a worst-case scenario no healthcare worker ever wants to be in, and the state never wants to consider, deciding who lives and dies if life-saving resources become hard to find.
And I hope that not a one of them ever has to use that. And I hope that we never get there. We absolutely do not want to play God.
The 36-page public document lays out a scoring system healthcare facilities would use if they were ever faced with a triage situation. But it's received criticism.
It created fear amongst our kupuna because in the plan there was consideration for rationing care under certain circumstances, severe shortages, to the elderly, and that's not anything we could accept.
The document reads advanced age was rejected as a consideration because it discriminates against the elderly, stating there are instances an older person could have a better outlook than a younger person. But when it comes to COVID, age will be only used in a tie-breaking situation, adding evidence shows being 65 and older is a poor prognosis in COVID-19 patients, and a COVID-positive patient 65 and older is less likely to benefit from scarce resources. Green says he received dozens of phone calls from kupuna.
When a 75-year-old woman reaches out to you and she's afraid that if she gets sick, she won't be able to go to the hospital for life-saving care, that's when you know you've made a mistake.
Hospitals on Oahu were at a critical point 2 weeks ago when there were nearly 450 patients hospitalized with COVID. Triage tents went up at most major hospitals to handle any overflow. Thankfully, hospitalizations have dropped 30% since then.
I think that it's important that everyone realize we will not need to ration care. I will fight against it.
Green suggests using other facilities, bringing in hundreds of additional federal help, using monoclonal antibody treatment and long-term care facilities first.
All of those are possible solutions before we'd ever tell someone, you know, your mom or dad or your elderly grandfather does not qualify for care. We should never do that.
Nikki Schenfeld, KHON2 News, working for Hawaii.